Welcome to the Deep Dive.
Oh, thanks for having me.
Today, we're diving into the world of pulmonary artery pressure monitoring.
Oh, cool.
Using some medical training materials that you sent over, it's going to be fascinating. Kind of like peeking behind the curtain of your cardiovascular system, you know?
It's amazing how much goes on in there, right?
Exactly. So much we take for granted. But first, let's imagine for a second, you're a red blood cell, about to embark on this incredible journey through the body.
Quite a journey, yeah.
And the journey begins in the left ventricle,
The heart's powerhouse.
where the pressure is a whopping 1,200 millimiller Hg.
Talk about a kickstart. Sending that blood cell surging into the systemic arteries.
It's like blasting off into a superhighway of blood vessels.
Pressure holding steady at 1,280 millimilli Hg.
Cruising right along.
But then things get interesting.
Oh, how so?
Well, as our red blood cell enters the systemic capillaries.
Those tiny, thin-walled vessels.
Exactly. The pressure takes a nosedive, plummeting to just 30 millimilli Hg.
Whoa, that's a dramatic drop. Why such a sudden slowdown?
Well, think about it this way. Imagine trying to pass a package through a crowded doorway. You need to slow down, right? Same idea here. The pressure drop in the capillaries ensures enough time for that vital exchange to happen.
Exchange of film.
Oxygen, nutrients, waste products, the essentials.
Ah, I see. So after those deliveries, where does our intrepid red blood cell head next?
Onward to the systemic veins.
And the pressure there.
Eases even further down to 10 millimilli Hg.
Wow, quite a range. And finally,
Back to the heart's right atrium, with a pressure of a mere 2 to 6 millimilli Hg.
quite a journey indeed.
It really is. A marvel of nature, wouldn't you say?
Absolutely. So we've talked about the blood's path and how pressure changes along the way. But how do we actually measure those pressures in a clinical setting?
That's where the pulmonary artery catheter comes in, or PAC for short.
Also known as the Swan-Ganz catheter, right?
You got it. Think of it as a tiny submarine.
A submarine.
Navigating the heart's chambers, gathering vital intel.
I love that analogy. So how does this submarine actually work?
Well, it has a distal port right at its tip, nestled within the pulmonary artery.
Okay, and that allows for...
Measuring both pulmonary artery pressure, AD wedge pressure. We can even draw samples of mixed venous blood from this port.
Wow, multifunctional. What other cool features does this catheter have?
Well, there's a balloon inflation port, crucial for maneuvering the catheter into just the right spot.
Okay, I'm picturing a tiny inflatable anchor helping the catheter stay put.
Exactly. And about 30 centimeters from the tip, we have the proximal port. When positioned correctly, it sits in the right atrium. This port measures central venous pressure, or CVP.
CVP, got it.
Gives us insights into the right side of the heart.
Okay, so why is CVP so important?
CVP, it's like a pressure gauge for the right side of the heart.
I see.
Reflects the pressure in the right atrium, gives us clues about right heart function, tells us how much fluid is in the body.
Okay, so CVP can tell us if the heart's working too hard or if there's too much fluid.
Exactly. Imagine your heart is like a bathtub. The CVP reading tells us how full the tub is.
Oh, I like that.
A normal CVP, it typically falls between 2-6 millimilli Hg.
Or 412s in LH2O.
Yeah. Anything outside that range, it might be a signal to investigate further.
So monitoring CVP, making sure the tub isn't overflowing, so to speak?
Precisely. Now, let's shift our focus to the pulmonary artery itself. This is where we measure pulmonary artery pressure, or PAP.
PAP, okay. We're measuring pressure in the pipeline to the lungs, right?
You got it. And we want to see a PAP of around 258 millimilli Hg.
Got it.
Higher pressures, well, they could be a sign of trouble brewing,
Like
a blockage in those lung pipelines, maybe?
so like pulmonary hypertension.
Exactly. Or it could be a blood clot in the lungs.
Right.
Even left-sided heart failure, where the left side of the heart isn't pumping efficiently.
So the pressure backs up into the lungs.
Right.
PAP is another vital clue in this cardiovascular detective story. But we have one more pressure measurement to explore. The pulmonary capillary wedge pressure, or PCWP.
Ah, yes.
PCWP, what makes this one special?
PCWP, it gives us a peek into the pressure on the left side of the heart.
Specifically.
The left atrium.
Hold on, I'm a little confused. Isn't the catheter in the pulmonary artery? Not the left atrium.
Right. But that's where the balloon inflation port comes in.
Oh, right.
We gently inflate the balloon at the catheter's tip. It temporarily blocks blood flow in the pulmonary artery.
Creating a wedge effect.
Exactly.
So it's like temporarily damming a river to measure the water pressure upstream.
A perfect analogy.
We're using that wedge to get a pressure reading from the left atrium.
Exactly. And what we're looking for is a PCWP of around 8 millimilli Hg, ideally within a range of 412 millimiller Hg.
And what if it falls outside that range?
Well, PCWP, it's a key indicator of left heart function.
Okay.
Think of it like a thermometer for your heart. If it's elevated, it could point to heart failure, where the heart struggles to pump effectively.
Or a problem with the mitral valve, like mitral valve stenosis.
Exactly.
It's amazing how these pressure measurements can reveal so much. CVP, PBUP, PCWP.
They really tell a story, don't they?
They do. You mentioned earlier that PCWP can also help differentiate between types of pulmonary edema, right?
Absolutely. Pulmonary edema is a condition where fluid builds up in the lungs,
Making it hard to breathe.
right?
And by comparing PP and PCWP, we can determine the cause.
We can tell whether it's heart-related, called cardiogenic pulmonary edema, or due to lung-specific issues, known as non-cardiogenic pulmonary edema.
So it's like figuring out if the flooding is coming from a burst pipe inside the house or from a heavy rainstorm outside.
I like that.
So if both PCWP and PP are elevated,
That suggests cardiogenic pulmonary edema.
the heart isn't pumping efficiently.
Right, leading to a buildup of pressure that forces fluid into the lungs.
And for the non-cardiogenic type,
If PCWP is normal, but PP is increased, it points towards a problem within the lungs themselves.
not the heart.
Yeah.
This seems crucial, especially if someone is struggling to breathe.
Absolutely. Knowing the root cause can guide those critical treatment decisions.
It's all about putting the pieces together to get the full picture.
Precise.
This is incredible. It's amazing how these pressure measurements can tell such a detailed story.
It truly is. And there's even more to the story.
Really.
We haven't even touched on how PACs help us understand things like cardiac output, stroke volume, preload, and afterload.
All providing a comprehensive view of cardiovascular function.
Exactly.
This is fascinating. We've only just scratched the surface.
We have. I'm eager to learn more about those other applications.
Me too. But of course, we need to discuss the potential risks associated with PAC insertion.
Of course. It's all about weighing the benefits against those risks.
Absolutely. Well, before we dive into those applications and risks, I think we should take a moment to reflect on everything we've learned so far. This journey through the chambers of the heart is pretty mind-blowing.
It really is. The heart is an amazing organ.
I'm already thinking about my own heart differently.
Me too. It makes you appreciate the complexity of it all, doesn't it?
It really does.
It really puts things in perspective, doesn't it? And speaking of perspective, remember those other parameters I mentioned earlier?
Cardiac output, stroke volume, preload, afterload. Those ones.
Those are the ones. Crucial for understanding how well that heart of yours is functioning as a pump.
Right. You definitely piqued my curiosity about those. Let's start with cardiac output. That's basically the amount of blood our pumps per minute, right?
You got it. It's like a measure of the heart's overall productivity. And the pace thermistor, it plays a key role in measuring this.
Okay, remind me how the thermistor works again.
So we inject a cool saline solution, what we call a thermal bolus, through the proximal port. And then we track how quickly the temperature changes downstream using the thermistor. Boom! That gives us our cardiac output reading.
So it's like testing a river's current by seeing how fast a bucket of cold water disperses.
That's a great analogy. Pretty ingenious, right?
It is. And once we have that cardiac output number, we can calculate stroke volume, right?
Exactly. Stroke volume. That's the amount of blood pumped with each heartbeat. So we're not just looking at total output, but also the heart's efficiency with each pump.
So measuring the force of each individual wave in that river current.
Precisely. Gives us a sense of how effectively the heart is contracting with each beat.
Okay, so we've got the overall flow and now the strength of each push. What about preload and afterload? You mentioned those earlier, and they sounded pretty interesting.
They are. Think of preload as the heart getting ready for that powerful push. It's the amount of stretch on the heart muscle fibers just before they contract.
So like filling a balloon, the more air you put in, the more the rubber stretches.
Perfect analogy. In the heart, preload is determined by the volume of blood returning to the heart, how full those chambers are before that contraction.
And those pressure measurements we talked about earlier, CVP and PCWP, those can give us clues about preload, right?
You got it. CVP, reflecting pressure in the right atrium, gives us a good idea of right ventricular preload. Similarly, PCWP helps us estimate left ventricular preload.
So those pressure readings aren't just isolated numbers, they're giving us clues about the heart's readiness to pump.
Exactly. Now, on the other side of the coin, we have afterload. This is the pressure the heart has to push against to eject blood.
Okay, so afterload is all about resistance.
You got it. Think of it like squeezing honey through a straw. The thicker the honey or the narrower the straw, the harder you have to push.
Makes sense. So afterload is influenced by things like the size of the blood vessels and the thickness of the blood itself.
Exactly. And packs allow us to measure something called systemic vascular resistance. That tells us about the afterload on the left side of the heart.
Wow, so we're not just seeing how much blood is being pumped, but we're also understanding the workload the heart is facing.
Exactly. We're getting a sense of how hard the heart is working to do its job. And all of this information gathered from the packs, well, it allows for much more targeted treatment strategies.
It's like having a personalized performance report for the cardiovascular system. But of course, we can't ignore the potential downsides. There are risks associated with PEED insertion, right?
Right. While PEEs provide invaluable data, it's important to be aware of the potential complications. It's always a balancing act, weighing the benefits against those risks.
So what kind of complications are we talking about here?
Well, one potential risk is arrhythmias, irregular heartbeats. Those can happen during catheter insertion. And like with any procedure where we're introducing something into the body, there's a risk of infection.
So it's not a procedure to be taken lightly.
Definitely not. The decision to use a piece needs to be made carefully, taking into account the individual patient's situation, and the specific medical question we're trying to answer.
That makes a lot of sense. It sounds like PEEs are powerful tools, but they need to be used with caution and a clear purpose in mind.
Absolutely. But let's step back for a moment and reflect on what we've learned today. You've been on this journey through the heart with me. What stands out to you from our discussion?
Honestly, I think what fascinates me most is how these seemingly simple pressure readings like CVP, PVP, and PCWP can reveal so much about the heart's performance. It's like we're deciphering a secret language, one that lets us see the heart's struggles and strengths.
I couldn't agree more, and it really emphasizes the importance of critical thinking in medicine. We can gather all this data, but it takes human expertise to interpret it correctly and make the best decisions for each patient.
That's a really important point. PIATRs are amazing tools, but they're just one piece of the puzzle. It's the clinician's knowledge and experience that brings all the information together to guide treatment.
Exactly. And this leads me to a question for you to ponder. Imagine a future where we can get the same level of detailed information about the cardiovascular system non-invasively. No catheters, no risks of complications. How do you think that would change the way we approach cardiovascular care?
Wow, that's a really thought-provoking question. It's incredible to think about the possibilities that new technologies might bring.
It is, isn't it? But even with those advancements on the horizon, the knowledge we've gained about pressure monitoring, what those numbers mean and how they relate to the heart's function, it's all still fundamentally important.
Absolutely. It's like we're learning the language of the cardiovascular system.
Yeah.
And once we understand that language, we can start to interpret the signals, identify the problems, and ultimately guide those solutions.
Couldn't have said it better myself. It's all about improving patient care, one heartbeat at a time.
Well said. This deep dive has been truly enlightening. We've gone from a basic understanding of blood flow to a much deeper appreciation of the complexity and interconnectedness of the cardiovascular system.
It's been quite a journey, that's for sure. And we're not quite finished yet. We still need to talk about those risks and potential complications associated with PIGS. It's important to have the full picture,
You're absolutely right. Let's wrap up our exploration by taking a closer look at those considerations. After all, informed decisions are the best decisions. It's amazing how we've gone from blood flow basics to really appreciating the complexity of the cardiovascular system.
Yeah, it's been quite a journey.
And you're right, we need to talk about those PAC risks before we wrap things up.
Definitely important to have a balanced perspective. PAC's powerful tools, no doubt, but like any medical procedure, they come with potential downsides.
We talked about arrhythmias during insertion and the possibility of infection. What else should we be aware of?
Well, blood clots forming on the catheter itself.
Those clots?
They could break off, travel to other parts of the body, cause serious problems.
Not risk-free.
Not at all. That's why the decision to use a PAC, it's never taken lightly.
It's a big decision.
It is, weighing the benefits against the risks for each individual patient.
Sounds like the classic, the more we know, the more we realize we don't know.
Yeah, that's a good one.
We have these incredible tools,
but using them wisely
takes a deep understanding of both their power and their limitations.
Couldn't agree more. And it really highlights the need for ongoing research. As we learn more, we can refine techniques, develop new tools, minimize those risks.
It's exciting to think about the future of this field. Maybe one day We'll be able to gather all this info non-invasively.
I know, wouldn't that be something?
It would.
But even then, this knowledge about pressure monitoring will remain so important.
Absolutely. It's like learning the language of the cardiovascular system. Once you understand the language, you can interpret the signals, identify problems, and ultimately find solutions.
Exactly. And that's the ultimate goal, right? Improving patient care.
Well said. This deep dive has been a true eye-opener for me.
Me too. I've really enjoyed exploring these concepts with you.
And with our listeners. We hope you found this journey through the cardiovascular system as fascinating as we did.
It's a fascinating topic for sure.
Remember, knowledge is power, especially when it comes to our health.
Couldn't agree more. Keep learning, keep those questions coming.
Thanks for joining us on the Deep Dive.
It's been a pleasure.
We'll be back soon with another adventure in knowledge exploration. Until then, take care.